Hi, and thanks to everyone at Elderwerks for having this presentation. It was nice for you to invite me. I'm here to talk today about orthotic and prosthetic management and how orthoses and prostheses are mobility tools for older adults and for younger people as well, but we're specifically addressing older adults today. This is what I wanted to cover today, to discuss what are orthotic and prosthetic devices, because they really are more than just foot orthotics, and some people think they're only things you put in your shoes. They're a lot more complicated. I wanted to talk about decreasing fall risk and improving mobility as we age. I have in here a self-test to be done as a group to assess fall risk, if you like. It's an outcome measure called the Activity-Specific Balance Confidence Scale. It's commonly used. A little bit about diabetic foot care as amputation prevention and in general, and questions and answers. So first of all, here's a busy slide for you. What are these devices and when, why would I need them? Well, orthoses, I'm going to admit them. Orthoses include foot orthotics, leg braces, knee braces, back braces, shoulder slings, cervical collars, cranial helmets, and more. They're prescribed for multiple medical reasons, which can overlap. Prostheses are full artificial limbs as well as partial foot or hand devices that are prescribed after amputation. These things are tools to increase mobility, safety, and daily functioning. So this is a picture of somebody here on the left with a transfemoral prosthesis. On the bottom left, you'll see a woman in a scoliosis brace. There's an ankle foot orthosis going to the right, and then a knee brace, then foot orthotics, and upper extremity prosthesis, because my slide cut off over here, and then a knee ankle foot orthosis, which is a long leg brace, if you want to know what all those photos mean. And moving on. What are the reasons you might need these devices as you age? Here's some of them. So basically, they're a tool to reduce pain and increase mobility after lots of things such as osteoarthritis, surgeries, fractures, issues such as stroke, to prevent further wounds or deformities, and to replace function of missing body parts, amputated limbs or digits. So basically, they're tools to allow you to perform activities of daily living as well as work activities in conjunction with physical and occupational therapy. And some people come in and they see them as one more thing they have to manage, but when it comes to realizing it's a tool to help you get by, then the outlook changes with a lot of folks in our clinic. So this is the test that I put in the document section to do quickly. This is an outcome measure that we can do to assess fall risk, and then you can take this information for your own care and decide what you want to do moving forward. You can ask me questions, you can ask your primary care doctor questions. Basically, this is something we're going to quickly go through and score from 0 to 100% what you can do. And imagine how you can do this, whether you're normally holding on to someone or whether you're walking by yourself, and basically just putting percentages in increments of 10, 20, 30, 40. And you don't have to share your score with me. This is just something I wanted to go through quickly. And there are 16 quick questions. It is in the, like I said, it should be in the document section, or otherwise Kristen can add it as well. But basically, this is associated with figuring out what your fall risk is. And this was emailed to people by Kristen as well, so you have a copy of that, and it can take a few minutes. And I want you to just do that in the background, and like I said, it's in your email, and I can get back to that at the end. So I'm going to move forward. So basically, in terms of scoring, what you're looking at the end is self-confidence versus function equals impairment. And we can discuss it at the end, like I said. So here's some other information for you. What happens to our body as we age, especially in the lower limbs, and how do we attempt to manage it? Well, on your foot, on the bottom of your foot, the tissues of the skin change as you age. There's a loss of protective padding and elasticity, which can lead to issues which can cause pain and impair gait, and even pain itself is a risk for falling. There's range of motion issues. I'm not going to spend a lot of time on this slide because it's very busy, and we can always get back to it because I'm not sure how much time we're going to have. There's, basically your range of motion, how much you can move, your strength, if you have any body shop parts that are misshapen, the use of footwear, the use of orthoses can either impede or help, and lower limb pain can be an issue, and all of these can affect your mobility. And basically, there's some evidence, if you look on the right side, showing what O&P devices, orthotic prosthetic devices, can do to help you. That appropriate foot care and moisturizing and having wide enough toe boxes and not squeezing your feet into too small shoes, wearing an ankle foot orthosis if you need more stability. That's a brace that goes up to your calf, and not restricting motion unnecessarily when you don't need to, trying to avoid pain, trying to increase balance. I'm going to move forward. So I'm going to move into the diabetic foot care section because I think that's a lot of what people wanted to hear. Basically, here's some slide from the CDC, and part of why I think it's very important is that what people don't realize is, oh, I have diabetes, I need to check my feet. Well, part of it is that your ability to heal is affected by your blood sugar levels. And you can get a wound due to neuropathy and not even feel it. So it's really important to check your feet, because 80% of lower limb amputations, according to the CDC, are a result of complications from diabetes. So that's why I wanted to bring that up. Also, some people are at higher risk for lower limb amputation due to health inequity. And there are certain things that overlap. And also the amount of diabetes-related hospitalizations due to amputations doubled from 2009 to 2019. So here's some stuff by region, race, ethnicity, health literacy, and social determinants of health. South had the highest rate of amputations, possibly because of rural areas and lack of care and safe spaces for inactivity, safe spaces for physical activity and access to healthcare and decent food. Healthy food, not decent. Race and ethnicity affects Africans Americans in a larger share than others, as well as Hispanics, and likely due to barriers in care and some biases in the medical system, as well as to lack of information, which has to do with health literacy. Because if you have lower health literacy and in your community, then you have higher risk of amputation. And also, if you have fear of the healthcare system because of anything that's happened in the past, then you're more at risk. So also some areas where there's unstable work environments and such creates an issue. And I'm going to move forward a little bit. So basically, if you're diabetic, check your feet, see your doctor, then your orthotist prosthetist is needed. We operate by prescription. This is a licensure state. You need to see your doctor first to see us and to see anybody like me. I have some information from the Amputee Coalition. This fact sheet was actually done in 2016, but they wish me to add their 2025 logo on here. So basically, as of 2016, every day 250 adults lose a leg to diabetes, yet a lot of them could have been prevented. Basically, check the bottom of your feet, check between your toes, check your toenails, look for lumps, blisters, bruises, cracked skin, because things can become infected really fast. And temperature differences, shiny areas, pain, tingling, numbness, ingrown toenails, loss of hair because that's a circulation issue, And when you have questions, speak to your doctor, because it comes back to, oh, this might be nothing. Well, then 2 days later, it's really infected. And if you can't get in to see the doctor, well, you don't want it to be moving farther along in the infection so that it's not as curable. And here's some other tips here. The best time to check your feet is after a bath or a shower. Mirrors are really helpful. Amazon sells a foldable mirror made by multiple people that looks like a folding cane with a mirror on the end, and you can look at the bottom of your feet. Properly fitting shoes and socks are an issue. If your heel moves up and down in the shoe, you might need a heel pad because otherwise it can rub. If your toes feel too close together, you might be getting smushed in there. If you have hammer toes and the toe box is not deep enough, well, the top of your feet will rub and you can get wounds there too. There's also lots of issues that occur with diabetic feet, such as Charcot foot, where they get misshapen and the the bones kind of deform, and then the foot structure starts to fall apart, and that leads to need for custom shoes as well later on. But and another big thing that people forget is not to walk barefoot, because you might not feel something fall on your feet. There are people who've come through clinics like mine who've stepped on a nail through their boot and not felt it and wondered why they had a wound. And it's really phenomenal what neuropathy can do, and that lack of sensation and not knowing. So that's why you have to be careful with water or heating pads. You want to make sure you don't get burnt in the sun. Change your socks every day. Changing your socks and shoes and trying not to wear the same shoe every day is actually important, although a lot of us ignore that, because if you start to get a fungal issue in there, you don't want it to continue to grow in there and you want to be able to clean it out. So you can wipe out shoes with some rubbing alcohol, the inlays in there, or if you have foot orthotics, 90% alcohol works pretty good as long as you don't pour it in there. Just a little bit on a paper towel. So back to what orthotic management of the diabetic foot includes. On the lower left, you'll see Charcot restraint orthotic walker, and that's for Charcot foot when it starts to look like a boomerang and the bones are turning effectively to something resembling mush and the wounds occur. Ankle foot orthoses, custom shoes. Often you offload wounds by making sure that pressure doesn't occur on the wound site. And the thing on the far right is basically a custom brace built into a shoe. And that's a photo taken from Arizona AFO. In terms of how to heal diabetic ulcers, this is one standard of care. And a lot of times people will start, if it's a really bad wound, in total contact cast at the doctor's office. And then they might move on to that picture of the crow boot that I showed you, which has a lot of offloading and padding built in, and it's handmade for the patient, it's custom made. Then they graduate down to an Arizona type, whether it's a gauntlet, meaning, looks like an old-fashioned leather brace of sorts, or whether it's built into a shoe like you saw. And then, once things start to heal, hopefully the person graduates into either custom shoes or just off-the-shelf extra depth shoes. And sometimes if you do just accommodative insoles, meaning that it just accommodates what position they're in and doesn't correct. If the foot corrects a little bit, sometimes you can prevent more wounds. I'm going to move on. So I do have other slides I can add because I know I rushed through this quickly. Basically, we discussed the self-test to reduce fall risk, use of orthoses and prostheses as mobility tools, diabetic foot care to prevent lower limb amputation. Here's some references, because I do have couple other slides that I hid here because I kind of don't know who's sitting here and what they want to find out about. Here's some of the other slides that are hidden that in terms of how diabetes can lead to lower limb amputation, it has to do with high blood sugar, blood flow, nerve damage, and that small cuts could become a serious infection, and you need to clean the wound to remove dead tissue, and the doctor can do that and deal with antibiotics, and so that you never get to this amputation point. And that's part of what my goal is. And I can also talk a little bit about a couple other things too as we go. You can reduce your risk for amputation by learning diabetic management from your primary doctor or your endocrinologist, foot checks, foot screenings, managing your blood sugar, and with medicine and with diet. Basically, when you get a cut on your foot, it's best to clean it immediately. Soap and water, wash your hands with that. Use a clean bandage to apply pressure. Rinse with clean or running water or saline. Pat with a towel. Use antibiotic ointment. Seek medical attention if it's an animal bite wound or if there's glass, dirt, metal, anything you can't remove on your own. Bleeding doesn't stop. Or if there's pain, redness, swelling, or fever, or pus. And when to see a doctor is all of those things, as well as if you have pain or numbness, fungal infection, you notice change in color or swelling, corner of your toenails grows in on the side, you have blisters or ulcers that don't seem to be healing, anything bigger than 3/4 inch deep in size, and you can see the bone underneath. And if you don't have a doctor, keep in mind that Medicare covers a foot exam once a year in some treatments. Medicaid covers foot care in some states, and I believe it does in ours. Not everybody in the state, unfortunately, takes Medicaid. In terms of other things that I might want to mention, a lot of people will see having to use a device as a sign of aging or a sign of a hindrance. It really is actually a tool to help you get on with your life and prevent further injury, I don't like this word, but it is what's used in our profession, deformity, to keep you mobile and active as long as possible. So, corrective foot orthotics, which a lot of people are interested in, can often be a big deal after hip surgery, for instance, because one leg might be longer than the other, and that causes back issues, it causes balance issues. So sometimes these little things make a big difference. Bracing for osteoarthritis, is important too because of pain and stability when you're walking. Prosthetics is a whole other animal. Basically, you replace what's there, and if I align it properly, then you should be able to walk properly. And if there isn't, and I'm always available for questions or concerns. I'm in Palatine. I'm next door to the post office. We have hours by appointment. I'm here to help and answer questions. Don't be shy if you have questions.